Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering part 2 of therapeutic versus non-therapeutic communication. If you haven't watched part 1 already, guys, you don't have to watch it in any particular order, but I do urge you to watch both part 1 and part 2. Part 1, I go over mostly therapeutic communication. This is part 2, I cover mostly non-therapeutic communication. What you should not do, what you should not say to the patient when we're going over mental health. If you guys haven't done so already, please don't forget to like and subscribe below. Don't forget, guys, I have audio lessons available on my website, nexusnursinginstitute.com, where I cover the most important things that you guys need to know about psych, OB, peds, med-surg. If you are flunking and this next exam coming up, you absolutely must pass, make sure you check out my website and the resources I have available to you. If you guys want to practice additional questions, you can't get enough of it, you've watched all my videos on YouTube, be sure to watch me on my other social media platforms, where I cover different questions than I cover here on YouTube. You can check me, the handle is still the same, Nexus Nursing, and you can find me on TikTok, Instagram, Facebook, and don't forget about my podcast I have for nurse practitioners and, nurse practitioner students and registered nurse students. Podcast, same handle, Nexus Nursing. Okay, guys, without any further ado, let's get started. First question. A client on an inpatient psychiatric unit says, "My mother hates me. My father's a drunk. Right now, I'm homeless." The nurse responds, "Let's talk about your feelings towards your mother." Which is a description of the technique used by the nurse? 1, the nurse uses questions or statements that help the client expand on a topic of importance. 2, the nurse encourages the client to select a topic for discussion. 3, the nurse delves further into the subject or idea. Or 4, the nurse is persistent with the questioning of the client. And guys, the correct answer is 1. The nurse uses questions or statements that help the client expand on a topic of importance. What is this known as? Focusing. And I talked about this in depth in part 1. When we focus, we steer that conversation towards a specific topic where we want to speak about that patient's feelings in regards to that one topic versus, allowing that patient to jump from one subject to another. Okay. So that's focusing. Now let's look at our other answer choices. 2, the nurse encourages a client to select a topic for discussion. That would be broad opening, okay? So you're giving the patient a broad opening, something like saying to the patient, tell me what you're thinking about, or tell me what you're feeling, where they can talk about different subjects. You're really not focusing on one specific thing. Or you say to them, what would you like to discuss today, right? That's a broad opening. Choice 3, the nurse delves further into a subject or idea. What's that? That's exploring. You're exploring further into that subject or that emotion that that patient's been feeling. Choice 4, the nurse is persistent with the questioning of the client. That's probing. By the way, guys, probing is non-therapeutic. We don't want to do that. So probing is when you ask the patient a question and they really don't want to answer because that question is really intrusive, right? But you keep going and you keep asking them more personal questions that they don't want to answer. That is not therapeutic. All right, guys, next question. Which of the following are examples of therapeutic communication techniques? Select all that applies. Guys, how do we treat select all that apply? As true or false? Let's go. 1, tell me about your drunk driving record. False. That's probing. Tell me about your drunk driving record. Do you think that patient's going to want to open up and talk to you? No. A better thing to say would be something like, tell me how you feel drinking has affected your life. And then they'll say, oh, well, I've got some drunk driving on my record. I've been arrested. I got my driver's license taken away. Do you see the difference, guys? So 1 is false. We're not going to choose that because that is not therapeutic. Probing is not a therapeutic technique. Choice 2. How does this compare with the time you were sober? True. True. That absolutely is therapeutic, guys. This is encouraging comparisons, and you're helping the patient to be able to point out similarities and differences, okay? You're not telling them what the conclusion is. You're just helping lead them for them to form their own conclusion by what? Encouraging those comparisons. So yes, that is therapeutic. Very good. Choice 3. That's good. I'm glad that you can stop drinking. False. Why is that false? That's showing that you either approve or disapprove of a patient. And are we ever supposed to show approval or disapproval? Absolutely not. Because remember, as a nurse, it is not your right to judge that patient. So it's not your right to show approval or disapproval. So when you say to the patient, that's good, I think number one, you're making it about you. And number two, you're showing approval or disapproval, and you never want to do that. That is not therapeutic. You don't tell them, I'm glad, I think that's right, that's wrong. Absolutely not. We don't show approval. We don't show disapproval. We don't give our opinions. We don't give advice, right? So that's not therapeutic. Choice number 4. I think we need to talk more about your previous coping mechanisms. True. That's wonderful. What are we doing when we say that to the patient? We're focusing. We're saying, let's talk about this specifically. Let's explore this more, right? That's therapeutic. We're going to keep that. And 5, what led up to your taking that first drink after 5 sober years? True. And what's that known as guys, is sequencing of events. So for example, a patient is now in a detox center and you asking them, well, what led up to this? You're allowing them to give you a sequence of events. And when they're giving you that sequence of events, they're saying to you, okay, well, my boyfriend broke up with me and I felt depressed. So I went to the bar. And I went to the bar and I had one drink, then another and another and another, and I couldn't even stand, but I grabbed my car keys and I got in my car. Then I was speeding down the highway and I got in a car accident, etc. So it's allowing that patient to kind of see, okay, where did I go wrong? What actually brought me to this point? You're helping the patient see that for themselves. You're not leading them there, but asking them about the sequence of events is helping them walk through it so they can come to that understanding. And that is absolutely therapeutic. So what is therapeutic in this situation is number 2, number 4, and number 5. Which is an example of the therapeutic technique of voicing doubt. And I've talked to you guys about this in part 1. Don't forget what I said. We're talking about voicing doubt. 1, what I heard you say was, or 2, I find that hard to believe. 3, are you feeling that no one understands? Or 4, let's see if we can find the answer. And guys, the correct answer is 2, I find that hard to believe. If the patient says something to you and it does not fall in line with what you know to be reality, what the patient says to you does not fall in line with everything that you're perceiving, it's called voicing doubt, and that is therapeutic. What you say to the patient is, and you're putting the blame on you, not the patient, you're putting it on you. I'm having a hard time believing this, because you said XYZ, but I'm seeing ABC. So when you say that, number 1, you're putting the blame on you, not the patient. So you're not calling the patient a liar. You're saying that what you're perceiving is not what they're saying. That's number 1. And number 2, you're helping them to reconcile what's in their mind with what's really happening in real life. You're helping them come to terms with whatever emotions or thoughts that they were thinking or in their heart with what's really happening with reality, okay? So that is the correct answer. Now let's look at the wrong answer choices. 1, what I heard you say was blah, blah, blah. That's restating. When you're seeking clarification, one of the ways to seek clarification from a patient is to restate something that they said. Because just the act of that patient hearing you repeat something that they said and you just repeat it in another way, that can kind of trigger their thought process, and they say, you know what? No, that's not what I meant. I meant this. Or they can confirm and say, yes, that's exactly what I meant. Okay, so that's restating. By the way, restating is a form of therapeutic communication. 3, are you feeling that no one understands. That is verbalizing what's implied. So if a patient says something, they don't say, oh, no one understands me, but they say something like, you know what, every time I talk to somebody, it turns into an argument. Well, they may be implying that they're misunderstood. So you can verbalize that to see if that's really what they're feeling. Is that what they meant to say, or if it was something else? And guys, by the way, that also is a form of therapeutic communication. Last choice is, let's see if we can find the answer. This is what's known as suggestive collaboration. Let's work together and see if we can come up with some kind of solution. And that also, guys, is a form of therapeutic communication. But for this particular question, they were asking us about voicing doubt. And when you're voicing doubt, you're letting the person know that what they're saying is not falling in line with what you are perceiving or what you see to be reality. Okay, so that's why number 2 is the correct answer. Indicating that there is no cause for anxiety is to reassuring, as sanctioning or denouncing the client's ideas or behaviors is to 1, approving or disproving, 2, rejecting, 3, interpreting, or 4, probing. And guys, the correct answer is 1, approving or disproving. Now let's go back to the question, because this is very important that you understand this. Look at what it says. It says, indicating that there's no cause for anxiety is reassuring. By the way, guys, reassuring is non-therapeutic. You don't want to do that. You never want to tell a patient, oh, don't worry, or everything's going to be fine. Those are reassuring statements. We never want to do that. So it says that when you show that there's no cause for anxiety, you're reassuring, right? Comma. Now let's keep going. Such as sanctioning or denouncing. When you sanction something, that means you promote it. You say it's okay. Such as sanctioning or denouncing. Denouncing is when you make a public statement saying this is wrong. I don't agree with it, right? So sanctioning or denouncing a client's behaviors is what? And the correct answer is approving or disproving. And you are not supposed to do that as a nurse. You do not have the right to judge the patient. That is non-therapeutic. Now let's look at our other answer choices. 2, rejecting. That's also non-therapeutic. Rejecting is when the patient wants to express a thought, feeling, emotion, and you say, oh, let's not talk about that. Or, you know what, I don't want to hear that. When you do that, you're not only rejecting what the patient has to say, you're rejecting that patient. And that patient's going to clam up. They're not going to want to open up and talk to you. That is non-therapeutic. Choice 3, interpreting. Interpreting is when a patient says something to you and you say to them, oh, what you really meant was, you're telling the patient what they're trying to tell you. You're trying to interpret their thoughts, their emotions, their feelings. That is not therapeutic. That is not therapeutic. Therapeutic? Yeah, therapeutic with a V. That's not therapeutic. You always want to promote the patient to talk and express their feelings and their emotions. You don't want them to clam up. So if they say something to you and you're not sure what they're trying to say to you, or you think you know what they're saying, but you're not 100%, you can clarify, you can restate, but don't interpret. Don't tell them what they're trying to say to you, okay? And last, probing. Remember, guys, probing, again, is non-therapeutic. You do not want to do that. Probing is when you're asking them personal, intrusive questions, despite you can tell they don't want to answer, and you keep asking them different questions back to back to back. Okay? That is probing, and the patient's going to clam up. They're not going to want to talk to you. Which is an example of a non-therapeutic, therapeutic. What was I saying before? Therapeutic? Oh, gosh. All right. Therapeutic. Guys, you know English is not my first language, it's my third, so bear with me. Okay, guys. Which is an example of the non-therapeutic technique of giving reassurance? 1, that's good. I'm glad that you are XYZ. 2, hang in there. Every dog has his day. 3, don't worry. Everything will work out. Or 4, I think you should. And guys, when we're talking about giving reassurance, the correct answer is 3. When you say, oh, don't worry, everything's going to be all right. Remember, whenever you tell the patient that there's no cause for concern, no reason for them to be anxious, you're telling them everything's going to be okay. You don't know if everything's going to be okay. Why are you telling them not to worry? That is giving reassurance, and that is a non-therapeutic technique. You do not want to do that. Now, let's look at our other answer choices. 1, that's good. I'm glad that you are, that's what, guys? Approving or disproving. We're not passing judgment on anyone. You don't say that's good or that's bad, you're wrong or you're right. We don't do that. That is non-therapeutic. Choice 2, hang in there. Every dog has his day. That's what's known as a cliche. Cliches are very, what's the word I'm looking for? Shallow, okay? They have no depth to them, and you want to stay away from cliches because cliches are non-therapeutic. It does not facilitate communication. The patient's not going to want to open up and talk to you. And choice 4, I think you should, that's giving advice. You know that we do not give advice in nursing, right? So when they're asking about approving and disproving, the correct answer is number 3, don't worry, everything will work out. We don't know if everything's going to work out. We don't say that to the patients. Which is an example of the non-therapeutic technique of requesting an explanation. 1, who made you so angry last night? 2, do you still have the idea that? 3, how could you be dead when you're still breathing? Or 4, why do you feel this way? And guys, the correct answer is 4, why do you feel this way? Whenever you say why to a patient, you're basically demanding an explanation, and you're putting that patient on the defense. You're putting them in a position where they feel that they have to defend themselves. We do not want to do that, okay? So that is the correct answer for this. Now let's go over the wrong answer choices. 1, who made you so angry last night? You never say, you know how you never say to a patient why? You also never say to a patient what made you. And let me explain. When you say to a patient what made you, you're giving them a way out. Because the minute you say what made you, they'll say, oh, the voices in my head made me do it. Or, oh, I saw my grandmother ghost walking across the room and my grandmother, the ghost, made me do it. You're giving them an out. Do not do that. Okay? That's non-therapeutic. Choice 2, do you still have the idea that? That's actually checking that patient's degree of insight. And to be honest, we do not use this unless, the only time I ever can think of us using this technique, guys, and that it would be therapeutic, is if we're doing like a mini mental exam. Other than doing a mini mental exam, that's non-therapeutic. We don't do that. Choice number 4, why do you feel this? Oh, well, actually, you know, that's the answer. That's the one where we demanding an explanation. Oh, I skipped 3. I'm sorry, guys. How could you be dead when you're not breathing? They just put that in there, or if it's something, I don't know what that is. Out of all of the therapeutic and non-therapeutic communication techniques, I don't know what that is, so I couldn't even tell you, but I know that's not the answer. So your correct answer, guys, is why. And the reason for that is you're basically demanding or asking for an explanation, and that puts the patient on the defensive. And that is something you don't want to do. A client on the psychiatric unit says, it's a waste of time to be here. I can't talk to you or anyone. Which would be an appropriate therapeutic response? 1, I find that hard to believe. 2, are you feeling that no one understands? 3, I think you should calm down and look on the positive side. Or 4, our staff here is excellent and you are in good hands. And guys, the correct answer is 2. Are you feeling that no one understands? Guys, you always want to choose an answer choice that will promote communication. And I know some of you were tempted to say 1, I find that hard to believe. That's voicing doubt. And voicing doubt is a therapeutic form of communication, but it's only therapeutic in the right context. In this context, where the patient says, I can't talk to you or anyone here. If you say, I find that hard to believe, what are you doing? You're defending yourself. and the staff. So you're putting that patient in a position to be defensive and either say, well, no, that's not true, or, oh, I'm sorry, I didn't mean it that way. You never want to be defensive, okay? So guys, this is where your critical thinking comes in. An answer choice can be a beautiful answer choice, but if it's not right for the context of your situation, it's wrong. Nursing is not cookie cutter. That's why it's called critical thinking. Do you guys see how even though voicing doubt is a form of therapeutic communication, in this particular situation, it would be what? Non-therapeutic, because if you were to say that in this particular situation, you would be putting the patient on the defensive and you, the nurse, would be on the defensive, and that does not promote an environment that's conducive to the patient expressing themselves. Choice number 3, I think you should calm down and look on the positive side. You're giving your opinion. I think you should calm down. No, we don't do this, and it's not therapeutic. The patient's not going to express their feelings. 4, our staff's excellent. You're in good hands. You're being defensive. You're defending yourself and the staff, and that's going to force the patient to be on the defensive. No, absolutely not. You want to say to them, are you feeling that no one understands? Clarify that you understand what that patient's saying, and the patient say, yeah, I feel like no one understands because XYZ, or no, that's not what I meant. I'm just really upset about blah, 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 right? But you're promoting a situation where the patient will talk about their feelings. Next question. Which nurse-client communication-centered skill implies respect? 1, the nurse communicates regard for the client as a person of worth who is valued and accepted without qualification. 2, the nurse communicates an understanding of the client's world from the client's internal frame of reference with sensibility to the client's current feelings and the ability to communicate this understanding in a language attuned to the client. 3, the nurse communicates that the nurse is an open person who is self-congruent, authentic, and transparent. Or 4, the nurse communicates specific terminology rather than abstractions in the discussion of the client's feelings, experiences, and behavior. And guys, the correct answer is 1. The nurse communicates regard for the client as a person of worth who's valued and accepted without qualification. Let me tell you which phrases in here made 1 the correct answer when we're talking about respect. I want you to remember, guys, when it comes to patients who are depressed, or many who happen to be in a psych facility, right? They start to feel worthless. They start to feel down, like they have no value, right? So go back to number 1, which is the answer choice. You see them as a person of worth. They do have value. They do have worth. They have value and worth that's attached to them. And that's without qualification. That means without them having to prove anything, you find them worthy and you find them value. Okay? That is respect. Now, choice number 2, the nurse communicates an understanding of the client's world from the client's internal frame of reference with sensitivity to the client's current feelings and the ability to communicate this understanding in a language that is attuned to the client. That is empathy. Empathy is where you can see where that patient's coming from. In your mind, you can step into their shoes and understand their predicament and understand where they're coming from and have compassion towards them. Number 3, the nurse communicates that the nurse is an open person who is self-congruent, authentic, and transparent. That is sympathy. And last, the nurse communicates specific terminology rather than abstractions in discussion of the client's feelings, experiences, and behaviors. And that's what's known as correctness. So when we're talking about respect, number 1 is the correct answer. A client on a psych unit tells a nurse, I'm all alone in the world now, and I have no reason to live. Which response by the nurse would encourage further communication by the client? 1, you sound like you're feeling lonely and frightened. 2, why do you think that suicide is the answer to your loneliness? 3, I live by myself and know that can be lonely and frightening. Or 4, just hang in there. You'll see, things will work out. And guys, the correct answer is 1. You sound like you're feeling lonely and frightened. You're showing empathy. You're showing that you understand where that patient's coming from. You're looking at it from their point of view. And that's going to encourage the patient to want to open up and talk further about their feelings. Now, let's look at the wrong answer choices too. Why? Stop. What did I tell you about why? Do we ever start a sentence with why, a question with why, or what made you? Absolutely not. That is not therapeutic. So we're going to throw that out. Look at number 3. I live by myself and I know. It's not about me. It's not about you, the nurse. It's about who? The patient. We never want to make it about us, because once we make it about us, that patient's not going to want to talk about their emotions or their feelings. It's about them. That's not therapeutic. Choice number 4, just hang in there. Things will work out. What's that? A cliche. Do we use cliches in nursing? Absolutely not. And guys, that's why number 1 is the correct answer. The nurse is attempting to establish a therapeutic relationship with an angry, depressed client on the psych unit. Which is the most appropriate nursing intervention? 1, work on establishing a friendship with the client. 2, use humor to diffuse emotionally charged topics of discussion. 3, show respect that is not based on the client's behavior. Or 4, sympathize with the client when the client shares sad feelings. And guys, the correct answer is 3, show respect that is not based on client's behavior. So guys, you are accepting that client without any qualifications. They don't have to do anything to earn your respect. They don't have to do anything to prove that they're worthy of your respect. Because they are there, you find value in them. You see that they are worthy and you give them respect. And that's why number 3 is the correct answer. On the substance unit, a client diagnosed with cirrhosis of the liver tells a nurse, I really don't believe that my drinking a couple of cocktails a night has anything to do with my liver problems. Which is the best nursing response? 1, you find it hard to believe that drinking alcohol can damage the liver? 2, how long have you been drinking a couple cocktails a night? 3, if not alcohol, explain how your liver became damaged. Or 4, it's common knowledge that consuming alcohol continually over a long period of time can damage the liver. And guys, the correct answer is 1. You find it hard to believe that drinking alcohol can damage the liver. All you're doing, guys, is getting clarification to what the patient just said. But just the act of you repeating that and getting clarification, they're going to think about it. All right, I'm in a detox center or I'm in the hospital. My liver is shutting down. And here I am telling the nurse that my drinking doesn't have anything to do with it. Is that true? And the patient's really going to think about it just hearing you do that. And that's why it's the correct answer, guys. That's enough to bring them back to reality and to be able to confront reality versus what they had in their mind. Excuse me. Let's look at our wrong answer choices. 2, how long have you been drinking cocktails a night? What does that have to do with anything? That doesn't address the statement that the patient made saying that they don't think their drinking has anything to do with the cirrhosis of the liver, right? So that's the wrong answer. And it doesn't promote communication about the patient expressing their feelings as far as the link between their drinking and the cirrhosis is concerned. Choice number 2, if not alcohol, explain. Guys, do we ever tell patients to explain themselves? Absolutely not. What is that? We're putting them on the defensive. You might as well say to the patient, why did you do this, right? That is not therapeutic communication. So that's false. And then lastly, 4, it's common knowledge that consuming alcohol continually over a long period of time can damage the liver. Even though it's true that drinking alcohol over a extended period of time can damage the liver, that's absolutely true. But number 1, it doesn't solve our problem. It doesn't answer our question. That's number 1. And number 2, when you say to a patient, it's common knowledge, what are you doing? You're basically calling them a dumb you-know-what, right? Because if it's common knowledge, how come you don't know this? So you're putting that patient on the defensive. You might even anger them. Is that going to promote a therapeutic environment where that patient is going to want to talk to you about their feelings and their emotions? Absolutely not. All right, guys, we are down to our very last question. And before I do this last question, I want to remind you, I have so much content on my website. If you're struggling and you need that extra push, I urge you to check out my audio lessons at nexusnursinginstitute.com and just get a further grasp of this information. And it's not only psych, I cover all material, and I'm actually adding lessons weekly, so be sure to check it out. Okay, guys, we are down to our last question. Where am I? Okay, there we go. In dealing therapeutically with a variety of psychiatric clients, the nurse knows that incorporating humor in the communication process should be used for which purpose? 1, to diminish feelings of anger. 2, to refocus the client's attention. 3, to maintain a balanced perspective. Or 4, to delay dealing with the inevitable. Okay, guys, and the correct answer is 3, to maintain a balanced perspective. Guys, humor is actually therapeutic, and it has a healing nature if it's used in the right context of the situation. It can bring joy, it can bring hope to the patient, but it just has to be used in the right context. So if things have gotten too heavy and you want to lighten it up for the patient to be able to digest what's happening, you may use humor. But remember, like I said, it is therapeutic only if used in the right context of a situation, and it's used to bring balance to a situation. I know I said last question, guys, but I'm going to give you guys one more. I can't help it. I'll give you guys one more, and that's the last question. A client on an inpatient psychiatric unit has pressured speech and flight of ideas and is extremely irritable. During an intake assessment, which is the most appropriate nursing response? 1, I think you need to know more about your medications. 2, what have you been thinking about lately? 3, I think we should talk more about what brought you into the hospital. Or 4, yes, I see. Go on, please. And guys, the correct answer is 3. I think we should talk more about what brought you into the hospital. What are you doing when you say that statement? You're focusing. And that's very important for this type of patient, because let's go back to the question. It tells us the patient has pressured speech, they have flight of ideas, and they're extremely irritable. What are we suspecting the diagnosis is with this patient? We're suspecting that our patient is bipolar and they're in the manic phase. Remember, the manic phase, they're going, physically and mentally. So we need to get them to focus. So number 3 is the correct answer. Look at the wrong answer choices. 1, I think you need to know more about the medications. First of all, this is an intake process. During intake, you're getting information. You're not teaching. That's number 1. And number 2, this patient's in the manic phase. You think they're going to listen to anything you want to teach them at this time? Absolutely not. Choice 2, I think, what have you been thinking about lately? That's a broad opening. We cannot give a broad opening to a patient that is manic. They're all over the place. They're going to jump from one subject to another. You have to help them to focus on one idea at a time. So that's wrong. And then last, number 4, yes, I see. And go on, please. What's that? Those are general leads. You can't give general leads to a patient that's manic. Why? They're going to be all over the place. When a patient is manic, you have to help them do what? Focus. And that's why number 3 is our correct answer. And oh my goodness, I'm over my time. Guys, I hope you found this video to be helpful. If you'd like to see more psych, or if there's anything else that you'd like to see more of, or something that I haven't covered yet that you'd like to see me cover, please be sure to leave it in the comment section. I'll make sure I put it on my forever getting longer list of videos and topics to cover. Don't forget, guys, about my podcast and my other social media platforms. The handle's still the same across the board, Nexus Nursing. If you haven't done so already, please don't forget to like and subscribe below. Thank you so much for watching this video, and you'll see me next week.